Hello students, welcome to my channel and please take a moment to subscribe to my channel if you want to gain full concept of any topic you want. So hello students, welcome to the biology class, and in this class we learn about the topic the pulmonary tuberculosis. Since the short form of the pulmonary tuberculosis is TB, and TB is mainly the infection of the lungs. The lungs are the part of the lower respiratory tract. So it is the infection of lower respiratory tract, mean that it is the infection of lungs, and lungs are the part of the lower respiratory tract, mean that it is present at the end of the respiratory tract. So it is the infection of the lower respiratory tract. Pulmonary tuberculosis, which of the short form is TB, is a highly contagious chronic bacterial infection of lungs. Highly contagious contagious is a word which means that when a disease is caused by spreading from one person to another. For example, if a person with which you are standing has a TB, and if he or she coughs or sneezes, the bacteria from him or her passes into your body and you can become the victim of the disease. So it is highly contagious, mean that it is highly spread from one person to another, and it is chronic mean that when a person becomes the victim of the disease, the symptoms last very much longer and you have to survive with the disease for very much longer time, and you have to take the medicine for a long time. So it is a long time disease, and it is a bacterial infection of the lungs, mean that this disease is caused when a bacteria passes into the body and goes into the lungs and destroy many part of the lungs. So it is the infection or the bacterial infection of the lungs. In this condition, when the bacteria go into the lungs, the alveoli burst, mean that it burst or rupture or destroy and are replaced by inelastic connective tissue. As we have learned that alveoli contract and relax by the oxygen that it goes into our body. So alveoli has an expansion and contraction movement, and it has elastic body. So when it has elastic body, it can easily contract and relax. But when the bacteria goes into the lungs, it destroys the alveoli of the lungs, so it is replaced by inelastic connective tissue, mean that it can become hard for the alveoli to contract and relax. So it also affects the breathing system of that person who become the victim of the TB. As a result, the lungs become defensive against that bacteria. So the lung tissue finally become in a group and form a tiny capsule around the bacilli. Bacilli is the bacteria that causes infection in the lungs or that causes TB. So bacilli is a bacteria. So the lung tissues finally form a tiny capsule around that bacilli so that it does not further spread into the lungs. And this tiny capsule is called tubercle. But when the bacteria remain in that capsule, it divides several times, and the one bacteria become so many bacteria that when that capsule ruptures due to large amount of bacteria in that capsule, so when that tubercle or the tiny capsule ruptures or destroy or break down, the whole bacteria that are present in the tiny capsule is spread to all part of the lungs and to other organs of the body also, and can cause severe tuberculosis or TB. So students, now we learn about the causes of the TB or the thing that causes the TB. So that bacteria that causes TB is Mycobacterium tuberculosis. So pulmonary tuberculosis is caused by Mycobacterium tuberculosis. So it is the bacteria Mycobacterium tuberculosis cause TB. The symptoms are the after effect when a person becomes the victim of this disease. So the symptoms are the fever, that a person become ill, night sweats, mean that the person feel hot in night, usually during sleeping, weight loss, a person lose a large amount of weight, and this is because due to the next disease, that is anorexia. Anorexia is a feeling of a person who becomes the victim of the TB, that a person feels that if he eats a little amount of food, he or she gains weight. So it is a feeling or a disorder of that person that he or she eats a very less or take a very low amount of calories so that he or she cannot gain weight. And this is a disorder, because the person, if does not eat properly, he or she cannot become a normal person or feel good. So due to low intake of calories, very low intake of calories, the person lose a large amount of weight. And the next disease is also related to it, that a person become in depression, which is also known as malaise. And the person become weakness, dry cough with sputum. Dry cough with sputum mean that the person usually cough, and when he or she coughs, he usually release a liquid food with a mucus in it. Dull achy in the chest, as we know that the bacteria usually destroy many parts of the chest or lungs, which is the part of the chest or which is located nearby the chest, so it is also cause acne in the chest. The treatment is that the person is given the medicine for 9 months to cure the TB, and this 9-month course of the medicine given by the doctors are the daily observed treatment short course. And this course or the course of the medicine given to the person is under the supervision of doctors. So doctor ensure every day that the person is becoming cured with the TB or not. So it is a 9-month course of the medicines given to the TB person or a person that is a victim of TB, and it is ensured by the doctors that if the person become cured with the TB with that medicines or not. So it is given to the person or a patient under the supervision of the doctors, and is given to the person for about 9 months. So as we learned that it is chronic disease, so the person who becomes the victim of this disease have to take medicine for 9 months, and this is a very long lasting disease. So I hope that you like the video and you learn a lot about it, and I hope I fulfill all your queries about this topic. Please like this video and share it with all your friends.